on his back. The question is, do you think his head will be flat? And what should I do if it is flat? Now in this chapter, we're gonna go over why it's flattening. And then we're gonna go over what you can do at home developmentally to support your baby and at the same time prevent flattening of the baby's head. Now if we go over these sculptures, which I have made myself, since I couldn't find anything that would be really a good demonstration of what happens. So I made these two small baby heads. And we're gonna go over what happens, what is this flattening of baby's head. Now, first of all, let's go over the normal head. As you are aware of the fact that your baby's had a lot of bumps over the head when you feel this head. Especially the front part is soft, and that's where the four bones are meeting, and this area is called the front fontanelle. And also the meeting edges of the bones are soft at the back. Also at the meeting point of the three bones, the back of the head and the two side bones is the back fontanelle. So all of these soft areas allows your baby's head to grow as the brain grows inside the head. And what happens if your baby is always left on its back, even for hours during the day, and then you realize that there is an asymmetry at the back of the baby's head. And here maybe you can see it, that although this part of the head looks pretty round, the other side looks pretty flat. So this baby has been sleeping, preferring to sleep just like this. His head tilted towards the right side, and maybe his neck also tilted a bit to the side. And this way, as the back part of this right side was flattening, also you can see that the level of his ear is different on this side. This side has moved towards the front. So the flattened ear and flattened head side of the ear looks forward. Not only that, but when you look at this baby's face, the chin is asymmetric. If we let babies sleep on their back, and when they're playing and when they're active, always leave them as they are in their preferred positions, sometimes 1 or 2 babies out of 10 babies will have this situation. And along with this comes the flattening of the and asymmetry of the jaw joint and jawbone, and also tilting of the head, which causes cosmetic problems, as well as sometimes problems with chewing and proper talking. So we want to prevent this. It's preventable as long as it's not a problem of early closure of the head bones, which is a rarer situation. There are ways that we can do to prevent head flattening. So in the next slide series, we're gonna go over these preventive measures you can take at home to prevent head flattening.